Welcome to the session of our gender community of practice. I am Lena Arnold-Fritsch. I'm a development support manager at Cymru Africa, and I facilitate the gender community of practice, which we started a few years ago to provide a safe and inclusive space for practitioners in the Wales and Africa community to share learning and experience in the context of gender equality, gender justice, and women's empowerment. We meet about 3 or 4 times a year, and we always welcome suggestions for topics and speakers as well. So feel free to get in touch. And today's topic is period poverty or menstrual health and equity. Name it as you like, but it starts with menstruation. Menstruation connects us between Wales, Africa, and beyond. It's something very personal, but also perfectly normal. But obviously it's not normal or normalized enough. It's not talked about enough. And sadly, not everyone has got the means or the knowledge to manage their menstruation safely. I think it's clear that our experiences are shaped by inequality. And I think it's important to recognize that menstrual health is not just a hygiene matter, but a complex shared global issue affecting health, education, gender, and human rights. Clearly, it needs collective action. And at Cymru Africa, we can see that action is happening. Lots of great work is being done by organizations and individuals, both in Wales and Africa, and above all through partnerships. Today, we will hear from several experts, each bringing a wealth of experience and, of course, their unique perspective. And I hope, and I'm sure this session will help us to connect even more and to identify ways of addressing menstrual-related challenges in a way that is holistic, context-specific, and sustainable. And it's really encouraging to see the appetite in this conversation. I really look forward to it. I am joined today by my colleague, Ore Ojalade, our Diaspora and Inclusion Officer. She will chair the session. But before I hand over to her, I will lead you through some housekeeping points and the agenda. The session is being recorded, and the recording will be shared later through our channel, so it's always possible to catch up later on. We invite you to tell us who you are. You're welcome to put your names in the chat. It would be great though if you could mute yourself during the session to avoid disturbance. Definitely feel free to, or it would be great if you could turn your camera on, because it's so much nicer to talk to friendly faces. Make use of the chat function. Put your questions in. We will do our best to pick them up throughout the session. And for monitoring and evaluation purposes, there will be also a poll at the end of the session. It's quick, it just takes a minute or two, but yeah, we're really grateful if you could stay for that and participate, because we very much appreciate your feedback. Lastly, importantly, this is a safe space for minoritized people. We don't tolerate any form of abuse. We encourage challenging and constructive conversation, but people's lived experiences are not up for debate. And we'll be monitoring the chat. If you breach the rule, you will be removed from the event, and we will discuss the issue with you at a later time. If you do have any concerns and need to make a safeguarding complaint after the event, please contact Julian Rosser at hubcymruafrica.wales. Now, let's look at the agenda. After this bit, we will hear an introduction to the topic delivered by our first speaker, Mariama Jeloba. I hope I'm saying that okay. Didn't check with you. You're the country representative at Urbond in Guinea.
Yes.
Yes, or I will say more in a minute. After your introduction, we'll dive straight into our panel discussion with Mariama, but also with Dr. Salamatu Jeddah-Fada. She's the founder of Network of Women for Sustainable Development, operating in Nigeria. Molly Fenton, who's a Welsh activist and founder of Love Your Period, and Delith Paned, the UK country coordinator for Days for Girls. A really warm welcome to all of you. It's really great to see you. And or I will say further introductions in a minute. Just to say at this point, we would love the panel discussion to be guided by the audience, by your questions for the panelists. Then after the panel, and we'll have about 40 minutes after the panel discussion, there will be space for all other participants to share your own experience or stories in relation to what you will have heard. Yeah, and as mentioned, we will finish off with a quick poll. So, okay, I think it's time for me to hand over to Ari.
Hi everyone, thank you for joining us this wonderful afternoon. So to kick off, we'll be having Miriam Dingelo Ba. She's the country representative of YouBorn in Guinea, and she'll be speaking to us about menstrual health, period poverty, root causes, the stigma, and the global context in which period affects people. And Miriam will share her own personal view and give a professional perspective. So let's hear from Miriam now.
Okay. Good afternoon, everyone. Thank you for having me. So I was around 13 when I had my first period, and no one had talked to me about menstruation before, and I didn't know what it was or what to expect. So one day I just noticed blood on my underwear, and I was terrified. I thought I was sick or that something serious had happened to me. So I tried to hide it. I washed the stain quietly and said nothing to anyone, just to my friends at school. Because when I got to school, I told them, "Oh, I see blood and I don't know why it's coming," and they were like, "Yeah, it's something that comes every month." So even themselves, I didn't get any clear information from them. They just told me to use a piece of cloth or rag to protect myself. So sometime later, my mom found one of my stained panties. The little girls, we always, have, some bad habits. So she found one of my stained panties while doing the laundry. So she screamed. She was screaming out of anger. She was not screaming out of anger, but rather out of fear, because she thought something terrible had happened to me, or maybe I had been hurt or violated. So yeah, I can still remember her face that day, the confusion, the worry, the silence that followed. When she finally realized what it was, she only told me to be careful now with boys, otherwise I can get pregnant. That was the only thing she told me. No, so no explanation, no conversation. And from that day, I carried, two feelings: shame and curiosity. Why was something so natural surrounded by fear and silence? So years later, when I began working in communities, I met girls living through the same confusion, hiding, missing school, believing their periods were something to be ashamed of. And then that's when I realized that menstruation is not just a personal matter, it's a social one that touches education, dignity, and equality. And now, when we talk about period poverty, we often think only about the lack of pads or tampons, but it goes much deeper than that. I'm saying that out of experience. And I think that period poverty is not just about products, it's about dignity, education, health, and justice. And in Guinea, when we take Guinea, for instance, many families live on less than $1 a day. So for them, menstrual pads are a luxury. So most of the girls, they use rags or paper, or some even stay at home for several days, each month, because they fear staining their clothes or being mocked at, and because of this stigma that's happening in schools. So many schools don't have water, mm, toilets, or a safe place to change. So for these girls, skipping class, feels like the only option. But this problem is not only material; it's also cultural, because in many countries, in many communities, menstruation is still surrounded by taboo, especially in Guinea here, because girls are told not to cook, not to go to the mosque, not to sit with others, not to do this, not to do that. So they grow up believing that the natural cycle makes them unclean. And these taboos break confidence and silence voices that need to be heard. And then there are the policy gaps. When you look at the policy gaps, in most countries, including Guinea, menstrual health is rarely seen as a government priority. But just don't include it. Schools don't teach it, and national policies often ignore it. And the result, millions of girls are left behind because of something entirely natural. So what do we do at Urban? So through my work with Urban and our partnership with Days for Girls and the UK embassy in Guinea, we've been empowering girls and women to take control of their menstrual health. We organize awareness sessions, train women to make reasonable paths, and create safe space for open dialogue. This is a way to fight, and then stop the stigma. So for the past 5 years, Urban has been, has partnered with various organizations to provide over 20,000 reusable kits to young girls, okay, from underprivileged communities in the Republic of Guinea. And I remember the first time we distributed reusable kits in one of our communities, the girls were shy at first, and even when you tell them about menstruation, they are shy. You will immediately see them, doing like this. They don't want to talk about it. But as we explained, you could see their faces change. They began to smile, to ask questions. They talk freely, and they show more interest in what was going on. And Urban we established a sewing center in Guinea here. It's in Dubreka, that is focused on producing reusable menstrual kits that we afterwards distribute in schools for free. Okay, and this initiative not only ensure a consistent supply of eco-friendly products, but also to create vocational training and full-time employment opportunities for local women, because we currently have 5 women who are employed full-time at the center that we established last year. And this just marks the beginning of a broader effort to foster economic independence and the environmental responsibility. So we've also trained teachers and parents to normalize the conversation, because most of the time when you see the girl, she doesn't know about her body, doesn't know about menstruation, it's because of the taboo. So we decide to go and meet the parents and the teachers to tell them that they need to normalize the conversation, because menstrual health should not be a woman's secret, but rather a community discussion. And I'm really inspired by how other places, unlike my country, like the Wales and others, leading the way, providing free menstrual products in school, integrating education in the curricula, ensuring that period equity is achievable, and yeah, when government, schools, and then communities really work together to break the taboo. And I really think that this global solidarity reminds us that menstrual inequity is not confined to one country or one culture. Whether in Guinea, Nigeria, or in the UK, we all face different versions of the same challenge, and we all share the same responsibility to change it. So today, as we begin this conversation, I invite you to reflect: what would our world look like if every girl could manage her period safely, confidently, and without shame? How much potential would be unlocked if menstruation stopped being a barrier and it became simply a fact of life? Thank you.
Oh, thank you so much, Miriam, for that short enlightenment on period and how much work you've done. So moving on now, we'll have a panel. So if you have any questions to ask the panel, after the set questions we're going to ask them, you could put your emoji up and raise up your hand, and I'll help you take that. So, but before we begin, we'll have some brief introduction of our 4 panelists. So firstly, we have Dr. Salamatu Fada. She's the founder of the Network of Women for Sustainable Development, working across 19 states in northern Nigeria, and she's based in North Wales, where she's also part of the North Wales African Society. Our organization supports local NGOs to provide menstrual product and hygiene education for schoolgirls in improving their retention rate and advancing gender equity. Secondly, we have Delet Paneth. I hope I pronounced that right. She's the UK country coordinator at Dates for Girls UK, with over 15 years experience in education in Wales, the UK and internationally. Delet leads a volunteer teams which manages key distributions and develop advocacy and education strategies to promote sustainable menstrual health solutions. You just heard from Miriam, and she's a country representative of Your Bud in Guinea, a multi-award winning charity aimed at improving education and opportunities for young people. Miriama leads an initiative that provides reusable sanitary kits, builds schools, and creates jobs for women, combining menstrual health education with community empowerment. Lastly, we have Molly Fenton. She's the founder of Love Your Period, a Welsh campaign challenging period stigma and promoting menstrual education. She began her activism as a teenager and helped shape the Welsh government's Period Proud Wales initiative, and she continues to inspire young people and advocate for menstrual equity. So would they like to say anything before we jump into the question or do you want us to jump into the question to our panelists? Dr. Salamatu, Mariama, Molly, Dalit, do you want us to go straight to the questions or do you have anything to say?
I'm good.
Okay.
Okay.
So before we begin, we are aware that menstrual stigma and shame are lived experiences for women and girls everywhere. Could you please explain or share your own view on what menstrual equity looks like in your context in which you've worked in? And what have you seen or experienced in your own community when advocating for menstrual health help for women in your society? Does anyone want to go first?
I can do. So, yeah, menstrual equity just means having equal access to menstrual products, to education and awareness, to funding, and also to policies in this space. I have never worked on period poverty in this country, in the UK. I live in Wales, and I've lived here for almost 15 years, but I've never worked here directly. I work with women in Nigeria on menstrual poverty. And the reason for it is because in 2020, during COVID, I was able to sort of organize women that live in diaspora that are of Nigerian origin from northern Nigeria. So those 19 states I'm working in are actually all in northern Nigeria. Nigeria has 36 states. So the 19 states I'm focusing on are in northern Nigeria. So we organize these women to look at the problems that are there right now in northern Nigeria that other women are facing, women and girls, and to see how we can intervene to support these women back home. So it's sort of give back.
Mm-hmm.
So we decided to start engaging these women. Some of them are in Canada, some of them are in Northern America, Australia, everywhere in the UK. Started engaging them and started having talks about what is happening as challenges. And so one person came and presented, did a presentation on period poverty and how they're supporting girls. And we found that that was very important, that we as women can actually join and support the local initiatives at home in Nigeria to ensure that girls go to school, they are enrolled in school, and they are retained in school, because there's high number of out of school children. And Northern Nigeria is very guilty of that. So that was what informed this initiative. So what we were able to do, we organized ourselves and got 3 local NGOs Nigeria has 36 states. We got one in Kebbi, one in Jos, and another one in Kaduna. 3 organized women that are already working with girls that are living in with menstrual poverty, and then started sponsoring them. I will quickly say the model we used at the time, we called period poverty elimination chain, PPEC, we call it. And what we did was for each one of us to sort of create a chain that you would have other people join your chain and sponsor a few girls every month with products, menstrual products. And so, for example, what I did was to get my daughter, my sons, some of my friends on my chain. So I was building my chain so that we can support these girls. And all the other women did the same. However, that model didn't work well. So I'm just going to stop here in terms of introduction so that other people can speak. But I will come back with all the barriers and the successes and everything that we were able to achieve using this PPEC model, and then where we are at the moment. So thank you very much.
Thank you, Dr. Salamata. Dalit, would you like to go?
Sorry. Yes, thank you. I would say that we do work in the UK, but we also work in at least 8 sub-Saharan African countries. So we do have vast experience across sub-Saharan Africa. I'm quite happy to take questions on that. My key takeaway with the menstrual equity is that we really do start to include boys and men in the conversation. And we've been doing that. And we've found that it's really empowering for all parties. They then go away and have those conversations with their wives, partners, etc. And that was my takeaway from my visit again this year, when we started doing it in Angola, that it was so empowering to include those boys in the conversation. And that will be my comment in response to that. So I can see somebody's got a hand up, so I'll leave it at that.
Okay. Madalito, please, do you mind sharing your question, please?
Oh, hello.
Hello, good afternoon.
Hi. Really wonderful to hear from you, Mariama. And, very humbling to hear your experiences. I think they are not very unusual. Although in my own country where I come from, let me just give you my introduction. I'm a doctor here in Bangor Hospital in North Wales. I'm a pediatrician, so my heart is very much with children and young people. I've lived here for 16 years. And this issue really was brought to my face by a lady I come from Malawi background, sub-Saharan Africa. So it would be interesting to know if Delith has actually worked in Malawi. And then the issue came to say there is a lady in Malawi called Dr. Moyo, who is providing sanitary pads and sanitary materials for young ladies in school, because girls don't go to school for 5 days when they are having periods, and therefore it's putting them back. Or the boys are continuing, and you know very well, if you're sick even for 2 days, to catch up with your friends, it takes a long time indeed. So if every month you are missing a whole chunk of education, then that's really you are really being pulled backwards. And in Malawi, we are a history where because being poor.
Sorry, Madeleine, sorry to interrupt you. So this specific session is for questions. Towards the end of the panel, would have the opportunity to hear your stories. I'm really sorry.
Sorry. Question.
To interrupt.
I think that perhaps I will wait for Dr. Salamatu in the end. I don't have a question, just to actually commend everyone here for the work they are doing. And my own story, I can tell you later as well. Just because Dr. Salamatu shared her own story, I just wanted to also tell you how I have been involved in this issue. But no question. Thank you, Orewo.
We'll get to that towards the end. Thank you. Okay, so another question for our panelists would be, what do you think is the role of men and boys in advancing menstrual equity and having and finalizing the discussions around menstruation? What do you think the boys and the men of the society are going to do to help speak more about periods, or maybe making more and a conducive environment for women to be open about speaking about? Because Miriam alluded to the fact that there's a lot of shame that comes to it. So what do you think we can equip men to do? So Miriam, you can go first, please.
Okay, when we talk about menstrual equity, for me, it just means that no girl should have to choose between her education and her period, and it's really important to involve boys and men in this discussion, because most of the time when you take, for instance, girls that are in school, most of the time they are surrounded with boys, and most of the time they are the ones who mock at them. So what we did for the past 3 years, we've been going to schools, discussing with girls, discussing with girl boys, and I will tell you that we have more boys and more men sensitized than young girls, because they are the ones who are always there to mock at girls. They're always the ones who are there. They are the ones who violate. They are the ones who discriminate. They are the ones who do everything. So that's why we decided that it was important to speak to those boys. And I will tell you a little story of something that happened because of lack of information and lack of how to deal with the situation. So what happened was in Koya, okay, it's another town in Guinea, where a girl was in the classroom and she found out about her period for the first time. So on that day, she had a teacher, a male teacher, and the male teacher also didn't know how to handle the situation. So the girl was obliged to stay there throughout her class until the class was over. She was staying there on her bench, and then she waited until the second group, like the afternoon group, because like they have the first group in the morning and then the afternoon group, and she was with the first group in the morning. So she had to wait for the first group to go home, and then the second group after classes. Now for the second group, when all the activities were over, the class and even the entire school was empty. That was when she was able to go back home. Why? Because the teacher knew nothing. He didn't know how to handle the situation. So that's why it's important to talk to these teachers and let them understand what is happening to the lady, to the girl, whenever she reaches, her puberty period. She has to menstruate, and menstruation is a normal thing. Without menstruation, humanity wouldn't exist. They need to understand, and they need to know how they should handle those kind of situations in case it happens in the classroom. Because again, the other reason why it's important, you see sometimes some girls, you find out that you have your period in the classroom, you can't come to the teacher and tell the teacher that you are on your period and you need to go home and change. Because sometimes you have some teachers, they're really strict. Once they are in the class, they don't allow people to go out, and it's a problem. They should understand, right? And so that's why it's really important to get them involved in the conversation, explain to them why they should be a support to those young girls, and they should understand that it's a normal thing. We're not doing it because we want it to happen to us, but it is a normal thing, and they should know how to handle it next time. Yeah.
Thank you, Miriam. Molly, would you have anything to add to that?
Yes, hi everyone. So for me, when I think of men's and boys' contribution, I think we're always talking about it amongst a group of people that understand. We're all here today. We've all taken this time out because we know that this is a problem and we want to do something about it. Who are the people that maybe saw this and thought, absolutely, am I not signing up to watch that? Who are the people that we need to have in the right rooms? We know the statistics coming out about the gender divide in our governments and our policy making decisions. And when it comes to menstrual equity, there is a huge problem there when it does come to that lack of infrastructure, be that around education or the advocacy side. And the policies that we need to actually back up a lot of the work that we're trying to do, which at the end does come under justice. You know, there's a huge injustice when it comes to this. So I think there is a crucial role for men and boys, be that as allies, educators, decision makers, and we need to have those open conversations. I started menstrual activism when I was 13. I was 16 when I set up Love Your Period, and I'm 23 now. When I was 13, it was campaigning for the free period products in schools. I found it so much easier to talk to male teachers than I did female teachers. And I will always hold that in my heart over the past 10 years and hopefully another 10 years of doing this work as I learn, because having those conversations are there. And the time and time again that I've heard people say, I just don't know if I can ask. Can I ask? How do I ask? What does this mean? What does that mean? Not everyone is so closed off to it, and I don't think the media and marketing that we've seen around menstruation has helped with that. So it's kind of going in with that open mind and going, conversations are great, but how can we ensure that we truly are creating an inclusive space, not just for people who do menstruate and for women, but also for men and boys as well. We need to take that a step further now, because we continue to have these conversations and asking what their role is. Maybe we need to work alongside with them to work out what that role is. And maybe it looks slightly different to how we think it does in our minds, but we've got to start with having that conversation.
Thank you, Molly. Dr. Salamati?
I thought somebody was raising her hand before me. I can see, or is it
Okay, Valerie Woodgager, please, do you have a question for the panelist?
Yes, I do. Two questions, actually. First of all, I hope all of you have heard, this is a question, have all of you heard of Learn with Grandma? Because if not, I want to tell you about a little bit about that and about what is happening in Africa with the periods. But I also see that we've got a gentleman in the audience, Dennis Kasaya, who I can't see which country he's from, but let's ask him what he thinks the men and boys can do to help women.
Okay, thank you for that. Maybe later on we could learn about grandma during
Yes,
the end.
I've actually put Learn with Grandma, the film that I would like to show, in the chat, so you'll be able to, everyone will be able to take it from the chat.
Okay, that's fine. Joanna, please, your hand up. What's your question, please?
Hi, good afternoon, everyone. Thanks so much for this call. It's really interesting to learn from you all. I'm based in Uganda. I'm a volunteer here with a small organisation. I'm just wondering if any of you have experience in an NGO context and in terms of particularly how to do outreaches, how to give support in a more self-sustaining way. Because I'm quite aware that if funding stops, then our work stops. So just wondering if anyone has any ideas to make things more self-sustainable. Thank you so much.
Yes, yes is my answer. So, Gemma, can you look at Learn with Grandma Uganda when we've finished, and you'll see the film that I've been talking about. And I've been in Uganda a couple.
Valerie, do you mind doing that later and let the panelists?
Can I go? Already?
Yes, please go on.
Okay, so men as allies for menstrual equity is really, I think, because I belong to two different continents and realities, they are actually different in many ways. The way the men's roles, for example, in northern Nigeria, is sort of different than it is here in Wales. I would say to you that there is a lot of stigma in menstrual issues. So maybe men can break the stigma and sort of act as act to normalize conversations. So if men can help people relax, whether they're family members or in school, it will go a long way to support girls in school and sort of their family members. And I will give you an example of that, how that works, even in my family. I have a daughter who is older, who is the oldest of my 4 children, and her immediate younger brother is 2 years younger than her. And over the years, he understands when she is in her period because of a little bit of tantrums or discomfort or whatever. So when discussions are going on and he sees the way she responds, he actually understands whether it is a bad time for this discussion or not. Sometimes he even teases her about it. Men can play that role. Is it possible in Nigeria, for example? I don't know for now. Why am I saying I don't know? Because even in the family setting, boys and girls are separated, especially in the rural areas. They are separated. You don't talk about, you don't sit down and chat, talk less of talking about menstruation. So I don't know, it's really a long way, but I think like Miriam and the other speakers have said, with sort of education and awareness, it really needs to be strategic. It really needs to be strategic. It needs to be designed in a way that both the recipient will be comfortable and the giver of the support will be comfortable. So I think what I'm trying to say in general is that in Nigeria and in Africa as a whole, both religion and culture play very critical roles in the way we are shaped and the way support is given and is received, unlike the way it is here. Here, there's a lot of education, there's a lot of enlightenment. Everybody wants to support the girl child, everybody wants to support children at whatever level. So it's easier. But there, you have to break the barriers. I'm an educator, like I said. And when I go to Nigeria to do sometimes even questionnaire administration, they have to gather the women separate for me, put them in a house separate, and assemble them so that I can interact with them away from where I interact with the men. That is the reality. So it is easier here than there, but I agree that men allyship is very critical in menstrual equality.
Thank you, Dr. Salamata. Dalit, do you have anything to add to it?
Yes, I was going to say that we have actively sought a program. We have a training program for men and boys, and we call it Men Who Know. And what we do is when we go into, I work extensively in Angola and a few other countries. And every time I am involved in a menstrual health program, the first thing I do is train local staff to deliver our program, which makes it a sustainable menstrual health program. As you've heard from Mariam today in Guinea, Mariam and the Urban team have been doing this for a number of years because the first thing they did was develop the menstrual health education program to make it sustainable. So that is relayed through one community to another across, a huge diverse population in Guinea. In Angola, what we did, we focused on our attention on actually recruiting men that would be willing volunteers within the community. And one of our passionate advocates for menstrual health education is an Angolan himself who actively now recruits individuals to come in on a volunteer basis and trains them, regardless of sex, men, women, it doesn't matter. They are all welcome within that safe space. And therefore, that's what he's done. And it has been proved very, very important that we develop that. We have the sanction of the Director of Education and the Director of Health in that province. We're extending up now back into the capital city. We started in a very remote province for other reasons. And that's what I'm saying. Now we've got to the point where we're actually able to, with the permissions of people on the ground, important people, the people who make those decisions, the vice governor of that province, the director of education of that province, the director of health of that province, the maternity hospital. Now, when we ask to go into a school and deliver the Men Who Knows programme or the Girls programme, we are given free access because we've already built those bridges within the community and we've been totally transparent about what we are going to deliver. And that is the key structure. You have to be totally transparent about your observation of cultural norms, religion, what is acceptable and what is not acceptable. And you take baby steps within those communities until you've established a bond of trust between yourself and that community there, wherever you're delivering. That's been my takeaway over the last few years. So if anybody has any questions, please go ahead.
Thank you. Joanna, have you gotten your question answered yet?
There were lots of very helpful points, thank you. But I think I was meaning like more financially. If anyone had, because I oversee the team, but I have a team of 4 Ugandan staff who are doing the work in the field, and working with local volunteers and with local government. But I'm just wondering if anyone has any ideas of maybe like mobilizing the community to fundraise for supplies or anything like that, if anyone has any experience. But thank you for what's been shared. That has been very helpful.
Thank you. Does anyone have any answer for that? Okay, Mother Little.
Yes. Okay.
Oh, sorry, go on.
I just want to respond to what's her name, please?
Joanna.
Joanna, yes, thank you for this opportunity and good afternoon once again. I think we need to look about sustainability approach to menstrual hygiene and poverty. And also, there is what we call tokenism, which I define as means in which you are giving people sanitary pads which cannot act as a sustainable element to end poverty. Now, this is where I'm going. Now, like USAID fund that is cut now into developing country, what happened to the people involved? It means that they will still go back in aspect of stigmatization, social determinant of it will still affect them because funding has stopped. Now, in this aspect of it, because you can't sustain giving them sanitary pads every month, there is need for us to look within what can we do in order to sustain this program initiative. That is where financial literacy comes in, skill acquisition comes in. A girl child must be empowered to able to knit its own sanitary pads, like swing, like we call it swing machine. I think days for girls, they are doing that, where they train people how to make their own sanitary pads. All these things can generate a source of income. Also, there is need for us to look within and ensure that every girl child is being empowered. Now, Dr. Salamat also talk about aspect of where culture have display in menstrual hygiene, where girls child cannot go to school because of culture. Some culture brings to form that discourage over discussion and restrict women participation in daily life activities, to the extent that some culture consider menstruating women unclean, limiting access to kitchen or public spaces. But when a girl child is being empowered, now the aspect of sustainability approach will be in face. Now, how can we do that? Number one, there's what we call financial literacy training. Let's sensitize them about how to save, village savings and loan. Number two, now we can also empower that what we call household economic strengthening, where we can empower an household by empowering. This is a approach which we call family-centered approach, which can enable family to take care for their needs. When you identify a need in a family by empowerment, maybe you have you establish them. By that, they can able to look for money to buy a sanitary pads. That's what I want to say at this point. Thank you.
Thank you so much. Does anyone have any question to ask the panelists directly?
Can I come in, please?
Yes, go on, Dr.
Just to add to what Simon is saying, and also to provide clarity. Simon, with our own, I told you about the model we used, the PPEC model we used, and we didn't want to jump directly into reusable pads. No, we're very sensitive. We have to be sensible and sensitive to the fact that we come from northern Nigeria. We border the Sahara Desert, so we don't have so much water. We struggle with water. Climate change is again compounding the effect of scarcity of water. So we didn't want to start with reusable pads, so that these girls, when they don't get those pads washed properly, it will not be another challenge for, another hygiene challenge for them. That was why we focused on one-use pads in the first instance. Looking at all avenues, I have now been able to send people to check whether there's the viability of rainfall harvest, to see whether we can actually harvest rain and then keep and use during dry season. And if that is possible, then we can now introduce the reusable pads. So even in our sustainable initiative, I'm a professional in conservation biology. So I care about recycling. I care about sustainability. I have a PhD there. I have taught in universities for over 20 years. For 20 years. This December makes it 20 years. So I know the needs to protect the environment. However, it has to be done the right way. You can't put in or accept a model or an initiative that cannot work in your instance. So you have to be smart, you have to be reasonable and also use the SMART goals to design any intervention that will work in the local community you want to work in. And Dennis, you were talking about training boys. We're talking about allyship. I just wanted to add to what you said. When you go to Africa and you go to the urban centers, the cities, sort of, where there's a bit of civilization, many people have gone to school, it's possible for you to get allies. It's very, very possible. Because why? They are educated, they're enlightened. But the majority of men in Africa are not exposed and enlightened and comfortable to engage in these discussions. So we have to target rural areas. We have to target hard to reach areas, because they are where the troubles are.
Dr. Salamata, I have to interrupt you there. You've made a complete assumption on my part. My project is in the far southeast corner of Angola, the remotest province I could work in. Okay. And therefore you have made an assumption that I work in the capital city or the urban areas. I don't. Okay. I work in in the most remote province. And I take exception to you saying that I don't seek out rural areas. That is exactly where I work.
No,
so
I'm
please,
not.
please
I'm
don't
not.
make an assumption.
I'm not.
when-
I'm not assuming, Delith. I have my reasons for. Very sorry that I jumped into conclusion with you, but I have worked with many people, and what happens is many people that come from overseas, they settle in these urban areas, and so they don't see the realities. If you are one of those that go to the remote areas, I give you credit for it. But I'm telling you, majority of people that come to help work in Africa don't reach the hardest, remotest areas. This I know. The statistics are there. So it is very, very important for everybody that is here to understand that the realities in urban areas are different from the realities of the rural areas. In the rural areas, it's difficult. In fact, most of them cannot even converse in English. So when you go there, they converse in their mother tongue. How do you start? You need interpreters. It's a process, you know. Well, let me stop here. Let me give other people opportunities to talk. But I grew up in Nigeria. I came to Wales just before I turned 40. So I have a lot of experience
Dr.
from
Fada,
Africa.
may I ask a
Yes.
question, please?
Yes, please.
Sorry to cut you because I think we only have a few minutes left. Delith and Valerie, question for you is outcome measures. Because I can't tell you my story, but things like stigma are real. However, if you go back a few years ago, there was a lot of stigma about HIV. And since we started talking about it, it has become normal. It has become, no, I'm on treatment, and my viral load is low, in my country at least. And it's not in urban areas, it's in rural areas. Everyone says, no, Tuesday is my day to go and collect my HIV medication. It's become a really pleasure for me because I grew up where it was really stigma, and I believe in breaking stigma as you are doing, teaching boys as well. However, my own experience is that I got a lot of hate from a girls' boarding school.
I'm awfully sorry to butt in, but my car has had to be gone. I've had lost my car for 2 days, and the garage man has just brought it, and I have to go and see to him now and pay him. So please forgive me, but I just want to say very quickly, one of the projects in Uganda, the creating sanitary towels, was started by a young man who saw the film and took action. He didn't tell me he was taking action. He came from the very far north of Uganda, almost as rural as I am in Brecon Beacons in Wales. we also live in rural areas. But what he did was he made a start, and now he actually said that what we did together helped him set up his project.
Thank you, Valerie. And
I must go. Bye-bye, everybody.
Bye-bye, Valerie.
Do all look on Learn with Grandma Uganda to see the film that I'm talking about, and you can share that anywhere you like, because I got it for free anyway.
thank you.
Bye now.
Ellen, were you trying to raise up your hand that you had a question?
No, I think I wanted to ask Delith about outcome measures. I am sorry to go back because
That's fine.
any project we make, we have to look at outcome measures because quickly, my outcome measures are simple. I sponsored a school and about 165 sanitary pads that were washable. And I used, African tailors, they make lots of clothes. And whatever is left, little pieces, were actually taken to have another lady making 2 big sanitary towels for the night, 2 for the daytime, lighter ones, and we provided 2 pants, underwear, and a bucket. And all that costed less than £8 and per girl. And supplying 165 girls, they are all going to school. Simple outcome measure. But again, I am so interested about training and teaching teachers, and because my hurt came from other girls, other, women. If you just as much as show, like an accident, you would get slack from the other women. And the men were never, they didn't actually cause me hurt at that point, but fellow women did. And it was not acceptable to show that you have had you are in a period. And so I feel sorry for that girl who had to stay in class for the whole day, Mariam. So it's really something that I am interested in, and I've done it at small scale in my country, Malawi, but I would really support anyone who, I would really be interested to look at the training materials, for example. Thank you. Sorry to have taken time.
That's fine. Deli, do you have any answers to that?
Yes. I'll give you 2 outcomes. The first one was that we look at, as you say, the absenteeism of those girls. And we go back to those schools and we establish how many of those girls now attend school full time. And we do get those results, and they're coming through. And in fact, we'll have more results this year, more data collection this year, particularly in Angola. Mariam does it with Urbond in Guinea. She already does that as well herself. I worked with Urbond last year to set up the sewing team for them there in Dubreka, so that they could reach far more girls and go far further into Guinea than they we're able to do with bringing in pads, or collectively bringing in pads from elsewhere. So we've also done that in Angola. We've trained a team in the far southeast province of Moshiko, and that team is now up and running, and they are delivering locally within the local language. As you know, there are several local languages, so we do that. And that is my passion and my goal. That my passion is to support these locally developed sewing teams in countries where we can. In other countries that are already social enterprises present for Days for Girls, so we do not then go in and develop locally supported sewing teams. That is our caveat, that we don't interfere in countries that already have social enterprises set up. However, that some of them are far-reaching, some of them are not maybe stable, so therefore we will always look at each country on an individual basis. And that's as much as I can tell you. But yes, those are our measurable outcomes.
Thank you. And where do you get funding?
Sorry?
How do you source funding?
Oh, everywhere.
Everywhere.
I just want to add something to what Dilif was just saying, and it's really been incredible seeing how impactful everything we've been doing since inception, because we realized that when you take Dubreka, okay, the town where the NGO is based, is locally based. We are partnering with a school named the Application School, and in that school we realized that there were many girls not attending school, and we even had some kind of interviews with them where we questioned them about why they were missing school all the time, and based on what they told us that there was no toilet facility there, and whenever they wanted to go to pee or ease themselves, they had to go behind the school, like just sit on the floor and then do whatever they had to do, and then go back to the class. So there was no privacy at all. They didn't have access to clean water, not to toilet facilities. So they would prefer staying home while they are seeing their period rather than coming to school and being disgraced in front of their peers. So then Urban came up with a plan saying that, okay, right, the first thing we're going to do, we're going to put in place girls toilet facility. So yeah, so all of the girls in the school, they had access now to that toilet facility. We had some people saying, okay, this is like stigmatization. Why are you building that toilet just for the young girls? What about the boys? And we were like, okay, because the young girl, she's a special person, and if she's confronted to certain areas that are not clean, she's most likely to get an infection. She's most likely not to, have, intimate environment to herself. So we'd rather build that toilet facility for her, and we provide water, also run clean water for her. And since then we realized that when we looked at those girls' faces, the smiles and everything, we realized that it's really impactful. And then we had to come back to the school and find out how many girls are missing school since we put that tele facility in place. And then we realized that we made a great impact. So then we said, okay, the next action that we should do is really to find a way to bring reusable kits in Guinea, because most of those girls that you see, they miss their class all the time because they don't have access to pads whenever they're seeing their periods. So we started being in contact with some organizations in the UK, and then through some of our volunteers, we used to come out every year in Guinea. They brought some reusable kits to us, and then we bought them, okay, and we sent them to those schools to distribute them to those young girls, so that the aim is to keep the girl in school as long as possible. That's the aim, to make them not skip classes anymore. So that was the aim of the project, and we did it for the first time in 2021. We found the great impact that it created. And yeah, in 2022, 2023, we did the same. And then we said, you know what, we need to find a way. We need to find a sustainable way, to make this thing last. So even if the project is going to stop, but the information that they're going to receive, shouldn't stop. So this is how we came about making bringing the left to Guinea, thanks to Days for Girls, the partnership we had with Days for Girls. We started training other people, and then we started putting in place the sewing center. So with the sewing center, as I mentioned in my introduction, we have 5 women that are learning how to make the reusable kits, and then we taking those reusable kits, we distribute them for free in the different schools, where we give it to girls who are in the school who can't afford the menstruation pad. So yeah, so that's another sustainable another sustainability way that we've been really looking forward to achieve. And one of our objectives also is to get is to open as many centers as many centers as possible, so that we can reach as many girls as possible. Yeah, thank you. And sorry for the noise in the background.
Thanks so much, Mariam. Sorry, I'm jumping in, or I had to leave the room for a minute. Yeah, I think we've heard a lot of powerful points already. Officially, we would go into the audience round, although I think it's been a bit mixed already. Anyway, and I'm really curious actually to hear about funding. So a little more around that, kind of recognizing that yeah, menstrual health is it has been touched on already, but just to dig a little deeper there, why you think, well, to the panelists again, why you think it's been overlooked like that, like why it's not a funding priority apparently, and what kind of investment would be really important to create change, but also within Wales, yeah, what kind of investment would you like to see? Maybe, yeah, Molly, because we haven't really heard a lot from you yet, or not as much. So maybe you start.
So I think I can only speak from a Wales perspective. I'm quite honoured to be able to speak today, because I don't have many years and I don't have a lot of experience, and I do a lot of listening in spaces like these. So initially I thought maybe that's not a good perspective, but it means that I can learn, you can learn, and we've got to do it together. And I think that's part of the issue. A point was made about menstruation being seen as part of life, and wouldn't that be awesome? And I think that is amazing. But and I can only talk from a Wales perspective. There are so many things that we don't learn that I think are going to be the stepping stone for this. And when I was in school, no one taught me about my bowels, about my bladder, what going to the toilet looked like. If my heart was racing, what did that mean? How do I know if I feel sick, what is right and what isn't? There are very basic health things, I know menstruation should come into that we don't talk about already, that are not spoken about. And I think hand in hand with that, the language does keep changing. Lena, you made this point at the beginning. When I first came, it was period poverty, then it was period equity, then it was period equality, and then it was menstrual poverty, then menstrual equity. And these words have changed over time as we get to it. And now in the UK, we hear everyone saying menstrual justice, and they don't want you to say menstrual equity anymore. And first of all, I think it's dependent on communities. I think we should be able to use what works for us. But I also find that we're trying to keep people along on a movement that maybe gets confusing. And when you're talking to the policy people, when you're talking to the politicians, when you're talking to the people that are creating the money for things like this, it's very difficult to ensure that people are on the same page. In the UK, we have so many organisations compared to 10 years ago when I began. A lot of them are doing the same work and they're not working together because there is a big competition problem. So I think we need to, in order to view, there's two points to this: viewing it as that basic part of life, and then seeing how that wider fits into our lives, because the gynecological area is not in silo, and for at the moment it is spoken about like it is, and we have to look on the wider sphere. And I believe that is going to be something that will ensure that we open ourselves up to the opportunities of things like having more funding, because without that conversation happening to things that happen to 100% of people, like we all go to the toilet and people don't even want to talk about that. So how can we weave that into kind of like this part of life sphere for so many people that we're all affected by? And if we start talking about it in that matter, then maybe it'll be put into better context for the people that provide the money. And I wish it wasn't that way, and it's not fair, and it shouldn't be that way. But I think we all know here, no matter where we are, this is a problem that is going to get worse and worse and worse. And a point was made about how in Wales people care about children and we want it to happen. And yes, it is easier, but with our political climate and with everything happening, that's only getting worse. And it's going to get a lot worse, especially as we see the Senate elections coming up and then everything happening UK-wide. Many people are being left behind now more than ever, and the whole of Wales is being left behind in a whole UK-wide context. So I think it's arming ourselves now and thinking, what can we do whilst we're at a point where there are still funding pots available, there are still things happening? How can we group together and work together to make that happen? And in Wales and in the UK, we don't see it, and it's a horrible context and sphere to be in. So yes, that's my view on maybe how we can change things slightly to actually show funders that funding is needed, let alone us actually getting it. There's a step before that. How can we show them that this is why we actually need it and this is why it matters, and make it make sense to them in a time where the language keeps changing?
Thanks, Molly. Yeah, that was a lot in there, and I'm glad yeah, you brought it up. Yeah, I think Salamata, would you like to respond to that directly?
Yes, I wanted to probably just look at things holistically for us, because we're talking about different things, the same thing in different ways. And it's important that maybe we leave the meeting actually looking at the bigger picture, which also has a lot to do with all this fantastic work that is being done. How do you make it sustainable? Now, there are fantastic NGOs doing great work, like Delith, like Mariana, and other people. However, how much are they able to cover, in these countries? So what is the percentage of the impact of the work that you're doing? And why I'm trying to bring that up is just so that we can see that if we go work with government, for example, it can be, the impact can be better. It can be countrywide. Now, working with government is not easy, because what they normally would do as an NGO is to give you consent to go ahead and work in their countries. However, most countries would have ministries or agencies for women. For example, in Nigeria, we have Ministry of Women Affairs, something like that. And if you take a model, an NGO that is doing fantastic work with women poverty, it's possible to sort of have that conversation and see whether you can push it through them to become policy, to advocate for policy. And I'm talking about that because when it gets to policy, then this funding that is needed would then automatically come into place, because when something is policy, monies and funds are allocated to the project or the program, whatever it is going to be, captured as. So looking at the bigger picture, individually, how much can we actually do? Because even the work we started doing in Nigeria, out of 19 states, we were only able to contact 4, have interventions in 4, several times, but only in 4. And then the money, you keep on going back to the same person and say, give us money, give us money. But the moment you sort of articulate it well, and you look at the successes of what you have done, and then push it for the government. And of course, Molly talked about what do you call it, the government having the will, which is important, because that's what we are facing also in Wales now. We don't know what our government will be after the election. But however, if you have a government that has the will to push education and are interested in girls' retention in school, then they will push it forward. That's how I'm looking at it. If we can look at the bigger picture, maybe it will help the discussion.
Thank you, Dr. Salamata. I think Lorna Brown had her hands up at a point. You're muted.
Hello, can you hear me?
Yes.
Yes. Yeah. Well, thanks everybody for comments, but I'm involved with Don Fermio, which has projects in very rural eastern Uganda, and I'm a bit surprised that nobody has mentioned the possible manufacturing from local materials of sanitary pads. This has been on the go for a long time from papyrus and from banana fiber. I really wanted to know from the panel how successful this may have been. We looked into it, about shocked to see that it's 10 years ago now, and it was difficult to make progress. And since then, the idea of the reusable pads has come in. They seem to have been successful in the sense that people can make their own and recycle their own. But I think it would be good if there's an alternative. I think I personally would have preferred the alternative of single-use pads, which are then biodegradable. And I think that the industry, or whatever you might call it, of making these pads has moved on to getting rid of the plastic coating, which was a problem to start with. So I'd like to know if anybody else has experience in this. Thanks.
Okay, before anyone shares about the experts, I just wanted to let everyone know that now it's open for anyone to share, give their reflections, their personal strategies on their own personal stories with dealing with period poverty or menstruation. This is an open discussion now. So you can raise up your hand if you're comfortable to speak and let us know. Well, does anyone have any answer to Lorna's question or suggestion?
It's a bit sad.
I think it is an excellent idea, Lorna. It is an excellent idea because what you want to do is for people to use the local produce, the what they have, so that they don't, I think it's cost effective. And that is what we preach because of climate action as well. So it is very good to have people using local produce, byproducts from farm or whatever. So farm waste to make products. I think it's an excellent idea. And of course it's biodegradable. But I don't know if people have the capacity or they would need training or sort of capacity strengthening to be able to do those.
Okay, thank you, Dr. Salamatu, for contributing. Does anyone in the audience want to share their views?
Okay, yeah, I just wanted to add something to what regarding the funding that you mentioned, and but before that, what Lorna said about using those things, I think it's all a matter of knowing what it is about first, because I think there will be a lot of things involved in that. There will be a lot of things involved in that, like to make sure that what she's really asking for is first available, and then yeah, maybe there are some people who might do it, but for us, the only local product that we find in the market is the cotton piece of cloth that we make to make the shields, okay, because the shields is composed of a cotton flannel, and then we have what we call the PUL that we insert inside. We sew it together to make the reusable kit. But I think what she said is also something to exploit. Why not try and see if maybe it can work? Why not? Yeah. And now talking about funding, I think it's a little bit difficult. It's a little bit difficult because when I take my country for instance, the government don't care much about menstruation or even education about menstruation, because when you look at the curriculum that is taught in school, it's not mentioned there. And whenever we go to the schools to tell them that we want to sensitize young girls or young boys about menstrual education and about feminine hygiene, they'd be like, oh, okay, it sounds like a nice topic, but they see it like a waste of time. So if at the educational level they see it like a waste of time, what would the government think about it? So it's not a priority for them. Because if it was a priority for them, they wouldn't ask her for something in return. Most of these schools, when we go to deliver sessions to those young girls, they ask us for money in return. So this is just to make you understand. They don't take it seriously. They don't know the importance of it. That's why we make sure that in each and every school that we go to, we make sure that starting from the headmaster or the headmistress, coming to the teachers and the parents, the boys and the girls, we make sure that each and every person is sensitized on it, because they lack that information. And from for the fact that they lack that information, this is the reason why they're not taking it seriously. And you see a lot of girls they miss classes, they skip classes because they don't have menstrual kits to put on whenever they are on their periods. And they have, and some of the there is some silly there is some silly rule about any girl who misses her class. So they don't care whether you are on your period, you miss classes because of your period or anything. They don't care. They have a silly policy that if you miss your school, you miss classes, you have some a certain punishment. So you see, we have a long way to go. We have a very long way to go. And about this funding, since we've been working with Urban, since we started this project, we are working on our own with our own funds, okay, with our own funds. It's just that we are lucky enough to receive support from Days for Girls and receive some other financial support from the British Embassy here in Guinea. But talking about the Guinean government, they're not doing anything about it. Whenever you come to the school, as a matter of fact, they will be the ones asking you for money after the sessions. So I just wanted to bring that up.
Thank you, Mariam. Maybe for my part, this is Laura speaking from Uganda. And firstly, to respond to Lorna, we are having many small companies, that are manufacturing reusable pads. In Uganda, I think there is the AfriPads organization. They make the pads from reusable materials, cotton and all, but then they sell it, the different packages have different amounts of money. And of course, it speaks to the question of the affordability, so it's mainly organizations that buy from AfriPads and then they distribute to the vulnerable or marginalized communities. Then there's also this other model that some organizations are adapting. I think some of us have mentioned it here, that we get these retired women or any other vulnerable women that we would want to elevate out of poverty. We train them in making the sanitary towels, and then we give them the materials so they make, and then they distribute to different schools, whether it is small rates or not, it's up to that particular organization. But right now, I think there are small voices that are coming up that are speaking to the safety, of these pads, that at some point using these pads 3 or 4 times, they become depleted or they wear out. So you find a girl, or even they get irritated, the whole process of having to wash them and dry them. Remember, it is something that is a little bit intimate, so they can hide them under their beddings or mattresses to dry. And by getting them out, they're either, I don't know, you get the mix, yeah? So some girls may end up reacting to the materials that are being used and all that. So it's in between. Yes, they are needed, but then after 3 or 4 times usage, they are not necessarily that friendly. So in terms of sustainability, even the reusable pads have their own shortfalls. Now for Lorna bringing up, it's my first time to hear using the fibers or the different materials from. It's the first time I'm hearing this, and it's interesting to find out as in how would it look like. Maybe we are just not having the right capacity, or we are not aware, on using or making, pads from those particular materials. I believe they would be better than these other ones because that would speak to them being organic and maybe more friendly. But in terms of them being reusable, I don't know. I'm speaking to the point of ignorance. And then speaking to the funding component, I think in most cases, if you are to just submit a proposal or to seek funding just for, I would say, menstruation hygiene, right? Right now, sorry about that. The environment that we're in, where we are having limited funding, you're finding that you have to have a holistic approach, having a comprehensive proposal to a program that speaks not only to menstrual health or menstrual hygiene, but you're speaking, let's say, to capacity building of the teachers. You're talking to getting girls that had dropped out of school to return to school and to retain in school, something like that. That it being an independent component may be a bit tricky, but if we are to broaden our search, that menstrual hygiene is just one of those core components of a given program, I think it would be easier to attract, the attention of potential funders than if it is submitted as an individual plight for funding. Thank you.
Oh, thank you so much, Laura, for sharing. That was beautiful.
Can I respond to that?
Maybe in a short sentence, if you want to.
Yes, I just wanted to say to Laura that if you look on Learn with Grandma Facebook group, you'll find a film that I've told other people about, and I suggest that people do make them out of recycled material. Recycled material is, as long as it's pure cotton, it works very well. And a young lady in Cameroon, she washed the pads and washed them till they fell to pieces. And she reckoned, worked it out mathematically, that they would last about 4 years. So they're very economical, much more economical than any other way of doing it. And it works. It's been working for years. A young man in northern
Thank you.
Sorry.
We may have to stop right now. We need to.
It's just that I've managed to get back in again.
That's fine. Lena, do you want to say something?
Well, we are coming to the end of the session in a minute. I think there is a lot more we could discuss. It's quite clear there are very many layers to this, and obviously, yeah, probably material to go on talking for days. I was really curious to hear what Delith would say about the whole discussion around the material. I don't know, Delith, if there is a quick answer you have, then yeah, very, very happy to hear it.
My very quick one is we're currently working with an academic research unit in the UK, and they've developed a nanotechnology which you can spray on the fabric, which is antiviral, antibacterial, and stain diminishing, and that will, provide. And it's also, when it goes into the water, it actually, if you like, cleans the water per se, so you can wash your sanitary pad in very dirty water. And so this is an innovative technology. So yes, we absolutely encourage collaborations and innovative funding coming through. So, it's a case of watch this space.
Oh, thank you, Delith.
Sorry, Ori. Did you? Yeah, I'm happy for you to close it. That was really good.
Yeah. So thank you everyone for joining us today. It was really insightful to learn about ways we could continue to push in this agenda and encouraging ourselves to speak to men about it, because it seems like we also feel some kind of way when we speak to men about it. Maybe encouraging ourselves to come together to speak more, enlighten ourselves, encourage more men to participate in when it comes to discussions like this. So Lena has put up the poll. Please, I would encourage you to fill it up as much as you can. Give us some feedback. That would be great. And yeah, looking forward to seeing how this discussion moves in the next phase of it.
I'll leave it up for a minute or two.
Okay.
Yeah, I think.
And thank you everyone for joining us today. I hope you were able to learn something.
Yes, but I would love to connect. Valerie is seemingly having amazing ideas. Delith, all of us have had amazing ideas. I've just shared my email address in the chat group. Please feel free to reach out. I am very open to collaborating, but also to learn and collaborate at whatever level. So I'm happy to reconnect, and thank you very much for this platform. I think we could do this more often, and probably it would be better when we have particular actions we are moving forward with. I think it would make it more intentional and also more changing, Yes, but thank you very much.
Thank you. Thank you for that feedback, Laura.
Yeah, thanks so much from my side as well to all of the speakers for making the time today and sharing for all of you, your knowledge and your experience, including Molly as well. It doesn't matter how long you've been in the space, but I think it was really inspiring to hear from all of you. Yeah, I think that it was pretty clear how important it is to collaborate and to work together on this and to involve men as well as government levels, reach out and try to really do this approach this in a holistic way. I think that's become quite clear. I haven't had
Ever so
everyone
quickly,
onto the call.
I can't fill in the form that you sent. I just can't see it good enough. My eyesight, I have the magnifying glass, but it's not working very well. So please, could you send me the list of people who came? Because there are one or two that I particularly would like to contact about this project.
We can help with making connections afterwards.
I can prove it works over years. It's worked over years. I started it, I first saw it, I think, at least 10 years ago, and it's working so well in many parts of Africa, particularly in northern Uganda. A chap called Simon, he has set up a whole new project around it, and all he did was show ladies in his village the film.
Thanks, Valerie. That's
okay.
Great.
It's a great film.
I will help.
Bye, everybody.
Afterwards. Bye, and yeah, thanks everyone for joining us today.
Thank you, everyone, for joining.
Bye.